My name's Teresa Malik Searle. I'm a nurse practitioner. I work in a chronic pain clinic, taking care of patients with multiple chronic pain concerns. What we have to offer them in terms of comprehensive care is really a multidisciplinary, multimodal treatment approach, which encompasses more of a biopsychosocial model of treatment. There's multiple ways to treat chronic pain. And when you're looking at management of chronic pain, you really need to look at all of the modalities that you have available to you. So multiple different types of medications, pharmacotherapies that we use. And then you've got interventional techniques that you can use. So injection therapies, epidural steroid injections, various nerve blocks can be very helpful. But also pain psychology is incredibly important. So really being able to understand from the patient perspective the meaning of the pain for them, their feelings and their behaviors, and how that impacts their treatment plan. You have to kind of weigh the risks and the benefits when you're making recommendations for comprehensive pain management. There are side effects to all medications that you use, so you need to really be mindful of that. Opiates, which has been a mainstay of treatment of both acute and chronic pain for decades, has really put us in a challenging position because addiction is a real concern. The downfalls to looking at injection therapies are that they are invasive, right? And they come with a special set of contraindications and side effect profile, plus being able to find an interventional pain specialist that can actually provide you with those therapies. So even though we have an array of tools in our armamentarium, there are still a lot of gaps. I have always had an interest in virtual reality as a treatment for pain management. Walking around and doing acute pain consults, what I had noticed was the younger generations, they're on their telephones, playing video games, and that pain wasn't an issue. And I don't think that it was realized that one of the true strategies that could be incorporated would be this distraction or this engagement in the activity that they were doing and the technology that they were using. So did a lot of investigation about this, and it really started to hit home that this engagement had something to do with the kind of the change in the biochemistry of what we talk about a lot in changing perception and changing the whole neural networks. Everything that virtual reality is based on. It may sound ethereal, but I truly feel that virtual reality should be the cornerstone of where all chronic pain treatments then circle around. Cognitive behavioral change, mindfulness, really getting to the heart of, kind of changing patient perspective. That's where virtual reality is built upon. It's being able to really cognitively restructure, reshape their understanding of chronic pain management. I find Reliever to be an incredibly powerful tool in the virtual reality platform because what it does is it meets all of those needs that are missed. The education of the patient really about the importance of understanding kind of how the mind and the body work together for pain management. And it takes patients down, an algorithm of treatment. So it just doesn't give them a little bit of information and allow the patient to then try and process that information. It really takes you down a curriculum that has been, proven to be efficacious. Safety is definitely there. It's non-invasive. It's something that patients can then take and utilize at home. It incorporates what the patient has internally within them to really enable them to treat and get better. Yeah, it's been an incredibly powerful tool and has just got boundless opportunity. This is a win-win for everybody